Hey guys, it's Jason with Kentucky Sustainable Living. I've got Shelly from Two Old Crows Homestead with us, and then Chuck Peoples from Homestead Medical. Tonight, we're going to delve into practical medical training, stuff like that, talk about the festival a little bit, talk about Chuck's class or Chuck's workshop that he's going to teach at our festival. Shelly, go ahead and introduce yourself for anybody that doesn't know who you are.
Hey, I'm Shelly from Two Old Crows Homestead. I work with Jason doing our festival, and yeah, I'm here.
Chuck, kind of throw out who you are for everybody.
Chuck Peoples. I'm with Homestead Medical. Do medical training classes, sell custom-built medical kits and components, and going to come and talk and see everybody at the festival and teach a class the Friday before.
Yeah, and touching on the festival real quick, and I'm going to announce this again too later on. This is just a PSA. There's a lot of people that are confused about the festival. The festival is on Saturday and Sunday, the 23rd and the 24th. We've got tickets for sale. Your ticket admission gets you in to all the vendors, the demonstrations, and all the speakers there. Chuck's workshop and our ham radio workshop is an extra add-on to the festival, and it is on Friday. Those are not the only two opportunities you have to learn stuff. A lot of people are confused. They're saying on Facebook, oh my gosh, $35 to get in, and then $250 for Chuck's class, and then $425 for the ham radio class. I can't afford that. The $35 gets you all the speakers, the vendors, and the demonstration. Chuck's class and the ham radio class are just extras that are on there later. So we'll do that PSA again later on. But Chuck, a lot of people on here might not know kind of your background, what you've got, and they might be sitting there going, why should I let this guy teach me homestead medicine? What's his credentials?
I took a Red Cross first aid class about 17 years ago, and I feel like I'm pretty qualified to go ahead and teach it now. I mean, I don't practice it or anything. No, I've been a critical care paramedic. I've been in EMS for 29 years. I've worked municipal EMS. I've been a contractor and worked overseas. Done various different avenues of EMS, not just the traditional stuff. Started teaching about 25 years ago, EMS classes and stuff like that. And about 2 years ago, I kind of saw a hole in where a lot of people are teaching trauma classes, tactical trauma, stop the bleed, all that. But what do you do after you stop the bleed? So I kind of focused on prolonged care. What if you can't get to conventional medical care? And started putting together curriculum for that. I've developed several classes, and I've now been at the Kentucky Sustainable Living Festival. I've been Self-Reliance Festival, Midwest Preparedness Festival as a speaker. I've taught several private classes. Just did one this past weekend in Ohio. That tactical trauma, live fire. I heard there may possibility of a live tissue class. I won't confirm nor deny that. But yeah, I'm doing things that are different. I'm trying to do things that nobody else is doing, and bringing very advanced medical care to the everyday person, the homesteader, the prepper, just everybody who wants to be more prepared medically in case you can't get to conventional medical care. And it's not like the zombies attack or anything like that. It's natural disasters. Hospital systems fail. And look at our hospital system now. So there's nothing that says I can't teach you. I can't share this information for you. I just can't certify you as a wound care specialist to go out and open up Joe Blow's wound care clinic.
Yeah.
So it's for informational purposes only.
Yeah. And that's the nice thing that I like about what you're doing, Chuck. It seems like anybody dealing with medical, they just hit the stop the bleed, the traumatic injuries, and it's like we're always going to rely on life flight. They take you from throwing the tourniquet on and then calling for the medevac. And I can vouch personally. Chuck came down, did a 2-day class at my place. Shelly was there. We learned a whole lot of stuff in those 2 days. It was drinking from a fire hose, but I mean, everybody had their notebooks out, taking notes. We've got videos of a lot of that stuff that we can go back and look at still. It's an amazing class, and the niche that you're in, or the niche, however we want to say it, is awesome, because there's so many people that it's just like, yeah, I can slap a tourniquet on, but then what do we do after we slap that tourniquet on if medevac's not coming?
Well, yeah, I mean, and that's exactly right. What are you going to do? What if you have to take care of that person for 2 hours, 2 days, 2 weeks, 2 months? What are you going to do? And it's not going to be the gunshot wound because, the people are coming to take your land or your food. It's going to be, you're working on the farm, just doing your thing, and you're going to cut your hand while you're feeding the chickens or something, and then you're going to get poop on it because you're cleaning out everything. And 3 days later, you've got an infection, and then 2 days after that, it's gone systemic and you're septic. What do you do? Or how do you give those? All right, great. I've stocked up on antibiotics. I went to Jace Medical, or I've got, I hear people stock up on fish antibiotics if there's such a thing. But, what are you going to do with that? How do you know which ones to give for what you have and what the dosage is? And then how to do that prolonged long-term care? Or if you do have that cut, you can't get it. Do you suture it? Do you do a delay closure? Do you leave it open? Are you going to have to clean it with wet to dry dressings every day? Debride it? How do you do that? And those are things that I teach.
You let Shelly staple it.
Yep.
That's right.
That's right.
I can staple it.
And that's the other thing. Everybody thinks you have to learn sutures. And there's people out there who go, oh, come take our suture class for 4 hours. Let me explain something to you. Why do you think surgeons go to medical school for over 10 years? Suturing is not a 4-hour thing. I can teach you how to do a running suture, but that doesn't mean you're going to be able to handle every laceration like that. When 90% of the lacerations, except for facial things and things like that, you can do it with a staple gun. You can do it with a skin stapler, and I can show you how to do that. And that's the easiest thing to do. The easiest thing is closing the wound. It's what you do before, how you clean it, what you do, evaluating it, all those things. That is the real thing that you need to know what to do so you'll know if you should close it.
Yeah, and we did. I mean, we practiced the staples, and I mean, they're super easy. I mean, I think I would much rather, if you didn't have any lidocaine to numb it up, I would honestly rather have the staples than go through somebody suturing me personally.
I think so. Yeah, I agree.
I mean, it literally felt like a pinch is all it felt like. So, and I have been sutured when the lidocaine was wearing off, and it was not fun whatsoever.
No, it's not. And that's the thing with the staple gun, and you, Jason, you can tell them, experience it. It's not that bad. Now, if you have to get 27 staples, it might pinch a little bit, but really, you got a couple staples. How bad did it hurt? You had 0 lidocaine, 0 any pain numbing medicine. Yeah. It's not that bad.
No, I mean, it literally felt like somebody pinched you. So... And it was somebody, Shelly did it, and she had no experience whatsoever with doing it.
Yep.
So,
and I enjoyed it.
Well, I mean, that's still one of my favorite parts of any class I've taught, that when Jason said, I'll get stapled, and before I could finish saying, does anybody want to staple Jason? Shelly was up and shoving people out of the way to grab that staple gun to bury some into Jason. So that's still to this day, of all the classes I've taught, that's still one of my favorite moments of any class.
I hide the staple guns when Shelly comes around. Even my air staplers. I need to get a little sticker for my air staplers, not for medical use.
So yeah, I mean, it's valuable information, and people always put medical on the back burner. They don't think they need the supplies, and they definitely don't think they're training. And then they'll get supplies. And I know people who say, oh, I bought this big suture kit and this emergency surgical kit and everything. I said, oh, what training have you had? Mm-hmm. Well, I haven't got to that yet. Well, it's useless tools, and I asked them, okay, well, great. How much gauze do you have? Well, I've got, I got a box of 4x4s.
Well,
Yeah. I mean, you need cases of gauze. If you're going to stock up to take care of a wound, you're going to go through a bunch.
yeah. And that's the thing. All these people have all these Gucci guns and all the Gucci gear and everything else, and thousands of dollars in that, and they got $100 in medical supplies.
Yeah. Yeah. And they don't invest in the training, which
Yeah.
I think is the most important thing, because again, any training, you can buy all the radios you want. If you don't take a radio class and know how to use the thing, it's useless.
Yeah.
It's not going to do what you need it to do. It's just, it's not something you can kind of figure out on your own. Yeah, you could figure out some things medical wise, but most of it you need to know, because all of it has technique you need to know.
Yeah. And that's the thing. You see a lot of these guys, everybody does their firearms training, all their tactical training, and then they'll buy the medical supplies, and they'll buy a ham radio, and all that stuff is still in the box. They probably don't even know how to turn the ham radio on, and then all their tourniquets are still in cellophane.
Yeah, and that's the thing. Like the class I taught this past weekend, the people that were taking it had taken previous medical courses and stuff, and they had some experience. But the way we did this, and we tied into real scenarios with live gunfire, they're actually shooting at targets like as an active threat, but then you throw in the wrinkle of having to truly treat a patient. It's not simulated, and we're going up to them, and they don't know it. They're running drills, doing whatever, engaging a target or doing something. We're walking up, tapping them, going left leg. Well, they know then they have to put a tourniquet on, and they're out. And then I even told some don't respond, just go down. They're going to have to deal with that, plus the patient they were treating. And, there's a rumor there may have been a live tissue part on the range that was acting as a patient. So they were treating real wounds in real time with real blood. It's not simulated stuff. It's like, well, he's got a gunshot wound here, or he's got this cut here, or this. They were doing it for real, and it amps that stress up. And that's what we want. We try to put in a stress-induced situation, so when the real thing happens, you're not losing your mind. I mean, we had smoke, with smoke grenades going off, canned smoke. We had some real smoke. There may or may not have been a car set on fire on the range. We had simulated flashbangs going off. We were putting a lot of stress, a lot of wrinkles, and they really seemed to enjoy it. I try to do as much realistic training as possible. The tactical stuff is more of the tactical, but when we go and do the Homestead Medical stuff, it's more practical training. I do some stress-induced training, but it's more about learning technique and learning what you have to do. It's not death by PowerPoint. You all know I don't teach PowerPoint. I might throw a slide or two or a little video out there, but that's it. Most of it is we're going at it. We're doing hands-on.
Yeah. And that's the thing. And it's talking about the training. That's one of the big things we're talking about tonight. You offer different training. You've got a 1 day, a 2 day, and a 4 day on the Homestead Medical part, but you can also do the tactical stuff for somebody too. Another part of it is get the training, but then also get the supplies. And Chuck, on your website, Shelly, can you throw his website? It's homesteadmedical.us. Max showed up.
There's Max. Max has one of my favorite quotes. He made it into a shirt. It's like, carry a fucking tourniquet, have a fucking tourniquet. We did a podcast together on his side. He actually made a turret, and that little phrase kind of went a little mini viral. But Max is another good source of people. The people that come out, and Max is a big advocate of training. But they're taking medical training. They're doing stuff, but people just don't want to spend the money on it. They want to do the cool guy ninja shit. And I get it. I like the cool guy ninja stuff. I'm just as guilty. But I promise you're going to use medical. You'll definitely use medical at some point, probably more than once. You may never have to use that firearm or that tactical training. I hope you don't. But the chances, when you start weighing the chances of which one you're going to use, I promise you it'll be medical at some point.
Yeah.
So I want to tell you what happened. And I could really care less about the cool guy ninja shit. So Jason was talking about the class that you did for us. That was like 13 months ago, right?
I think we did it in February, so it's been
about a year.
Yeah.
So in a year's time, I think I've used that training at least 6 times. It seemed like every time we had a live video last time, I had like a new story. So recently, like 9 days ago, Randy had total knee replacement on his left knee. And it's funny, you said 27 staples earlier. That's exactly how many staples are in his knee right now. And they're supposed to be coming out Monday to take those out. I could totally take those out. Have complete confidence with that, but they're going to come out and take it out. So the day after, he came home on Wednesday of last week, and they sent him home with this drain tube. And it was really gross. I'm not gonna lie. It was like this little bulb, and it had the tube that came out of his leg. And I really didn't want to come home with that, but it was putting out so much that they were like, we shouldn't take this out. So he came home with it. And home health was supposed to come out the next day to take that drain tube out. And Randy got up at some point. I guess he went to the bathroom or something. I don't know. And I was sitting on the couch, and he's trucking along with his walker, and he's coming in there, and he walks into this little entryway right behind me, and he says, I'm running to you as fast as I can. And I thought it was a joke because he's like this old man on a walker, right? And I kind of laugh at him a little bit, and he goes, no. And he holds up the tube. It came completely out on its own, and it was bleeding like crazy. And no joke, the tube that they had in there, it was big. Like I didn't realize drain tubes were that big. The hole that it left in his leg looked like a bullet hole. It was, it was probably the size of my pinky finger, I guess.
Oh, wasn't that big.
And he's saying it wasn't that big. It was that big. And there's a scab on it right now. So anyway, so we go back into the kitchen, and I'm not gonna lie, I was like a little bit panicked because there was a lot of blood. And I was kind of at the time I was sitting there thinking, what do I do? And immediately I was like, I just took a deep breath, and I was like, I know what to do. I can do this. I went and got my stuff, my medical stuff, and I started, like putting gauze on it. And there was some gauze on there. I knew enough not to take that off because that was going to make it bleed even more or whatever. I put the gauze on there. I wrapped the cling stuff around it and all of that, put whatever that stretchy stuff is that sticks to itself, put that around it, bandaged it up, and it was fine. And I know that may sound silly, like anybody could do that, but it was fine. Just having the knowledge that I could do it, and because there was a lot of blood and it was a little bit scary.
Well, then when we seen them when that next day, he said, well, somebody did a pretty good job baby.
Yeah, the doctor told me that I did a good job taking care of him. So that was, like I said, there's been like, I'm pretty sure that makes 7 times. And the medical supplies, all of the stuff. I know that there's people out there like Jason that buys tons of medical supplies, and it's because, Jason's like waiting for the apocalypse and all that stuff. I'm just playing. He's not what, But last year, after we took Chuck's class, we all went together in our Kentucky Sustainable Living group, and we put this bulk order of medical supplies in because we got some really good prices on stuff, and we ordered a bunch of stuff. No joke, I need to resupply. Like, you need to have that stuff on hand. And I am thankful that, when it happens, it's better to have it on hand than to not have it on hand. And because what am I going to do? Tell him to stop bleeding while I run to the dollar store to get gauze? You need to have that stuff on hand. So you need the medical training. You need the supplies. And it's not the apocalypse, people. We need the stuff. It's stuff happens. It's not. We live on a homestead, and we get cuts, we get scrapes. My daughter got bit by a dog. I fixed that up. There's just numerous things that have happened, and I'm so thankful that I had that training. It was so beneficial to me.
Well, it's something you'll use every day. It's not just in
Every day.
end of the world. It's not just, you may pull up on a car wreck, your kids get hurt, and when you have that training, you may look at a little cut on the head and it bleeds profusely. If you don't know that, you're going to think, oh my God, it's the end of the world. They've got a huge one.
Right.
Well, when you stop it and you see it's not, because your skin is so tight on your skull, and your capillary beds, there's a huge amount of capillary beds on it's going to bleed a lot. It looks 10 times worse than what it is.
Yep.
But when you're able to have that knowledge and you're calm about it and you've trained in it, you're able to take care of stuff like that, where, and you can't tell me that's not beneficial to you and your loved ones, and how would you feel if you sat there and watched your spouse or one of your kids or somebody you cared about was hurt and you couldn't do anything? You didn't have the supplies to do anything. You didn't have that. So it's extremely important that I think you take that. And I'm not saying it just because I teach it, but yeah, it's a livelihood. I want you to take my classes, but I think if you look and you weigh the benefits of it, it should come out on top. It should be one of the first things you do, and you make it a priority instead of putting it on the back burner.
And I want people to understand, this is not your first aid CPR class.
No.
That is not what this is. Like a first aid CPR class is like you learn that kind of trauma stuff so you keep somebody going until the other people get there. This is the class where you're the other people. Like seriously, it's how to take care of people beyond the event happening. It's how to take care of wounds. It's how to change stuff out. It's how to check vitals and understand what's going on. It's just so much more than first aid and CPR, because I think a lot of people think, oh, well, I've had that with my job or something like that, and I get that, I understand. That's not what it is. It's totally not what it is. And the accidents that we've had in our home, I was able to, take care of that stuff with confidence. And I'm not a doctor. I'm not proclaiming to be a doctor. Chuck's not proclaiming to be a doctor or whatever. But I was able to do things that before I would not have felt confident doing, if that makes sense.
You left me up being a doctor.
Jason's definitely not a doctor.
Well, and going back to what you said about the equipment, you don't have enough gauze. You don't realize until you take care of a wound for several days and just for a week, you'll be surprised how much stuff you go through. Like I had so many orders come in this past week. I'm out of stock of a bunch of stuff, and for some reason my website is not doing the math. For some reason, Shopify apparently can't add or subtract when things are ordered. So I'm out of stock of some things taken, but I'm having people now ordering, and I'm offering it on my website, cases of gauze, cases of 4x4s, cases of 5x9 dressings, because people want it and they're ordering it. Garrett and Angela from Grumpy Acres ordered cases of stuff. I've had several people, and I just had somebody order a case of gauze yesterday. They'll put a huge order in, and I'm starting to see a pickup of people and names I don't recognize. Of people putting in big orders, $500, $600, $700 worth of equipment, because I think they're starting to get it and realize, hey, wait a minute.
Right.
When you go sit in the ER for something very minor and you're sitting there 18 hours just to see a doctor, I want you to think about that. And EMS isn't 7-10 minutes away like it should have been or should be, or like it used to, because guess what? There's a shortage in the hospitals. So there's even a bigger shortage for EMS. You may be waiting 2, 3, 4 hours for an ambulance because your closest one and your next closest one is busy. It's having to come from an hour away. Helicopters, they only fly when there's good weather. I hate to tell you. Yeah. It's not like the Coast Guard. They're not coming in a raging storm. They're going to look out and there's a cloud in the sky. Some of them will go, nope, can't do it, weather. So, you got to think about it and look at the world's climate right now, and you look at what are the things that are going on all over the world. You know, you're kind of crazy not to be a little prepared.
Yeah. And Chuck, going back to the galls, what are your galls running? Can you pull it up on the website?
Yeah.
A case of galls.
Like $40, I think.
All right. That $40 or close for a case of galls. Don't go to Starbucks for a week and you've got a case of galls. And a lot of people now are like, oh, everything's so expensive. Yes, things are expensive. Don't get your freaking Starbucks for a week and buy a case of galls. You're going to be a heck of a lot better off with a case of galls.
You prioritize what's important.
For 96 rolls, they're sterile rolls. They're individually packaged. It's 96 rolls of 4-inch gauze, roller gauze, wrap gauze. $40.
Yeah.
A case of 4x4s, which is basically 400 4x4s, and there's two 4x4s in each package. So really, you're looking at 800. That's $60. A case of 5x9 abdominal pads, $40. So, you could, and that's quite a bit. And that roller gauze is just not to bandage with. You can use it to pack a wound. You can use it to do stuff. I mean, it's a looser weave than what actual wound packing gauze is. And I highly suggest to use that, but that can be used for that. It can be used for many different things. So it's a multi-use. So, it doesn't take that much. And like you said, I mean, a week of Starbucks, what are you kidding? It's more like 2 days of Starbucks. Some of the prices for their bitter ass coffee.
I hadn't been to Starbucks and I don't know when.
I don't go to Starbucks. I hate that their coffee tastes like. And yes, I drink coffee, not Muco, Luca, Wuka, Fluffy, whatever it is this week that they're drinking. I drink coffee.
Yeah. I hadn't been to Starbucks in years, so. But yeah, I mean that, and a lot of people get hung up on it is I don't have the money to put a medical kit together. You can put a stinking basic home medical kit together, relatively inexpensive. You don't have to have the Gucci stuff. And talking about Chuck, all your quick clot and gauze, you don't have to have that. There's a study that quick clot is not that much more effective than just regular gauze.
No.
Hey Terry, Terry, the website is in the comments. Shelly posted it. Can you post the website again?
That's my sister-in-law. Hi, Terry.
Is it?
Yeah. So Terry, it is homesteadmedical.us. That's the website.
I mean, I've got
homesteadmedical.us.
all my kits that I build. Like when you go and get one of my IFAC kits or the wound care kits and stuff, every piece of equipment that is in there, I have personally used on real patients. I don't like to have stuff I'm selling Slishman's wraps, which are great child tourniquets. They're great canine tourniquets, any animal, like large animal. I mean, and I know that sounds funny. What are you going to do? But if you have that milk cow and it's bleeding out, you kind of want to save that. You've invested in that. That gives food to the family. I just started the new snake staff tourniquets, which are the EDC tourniquets. They're a little smaller. I just became a dealer for them. I'm going to start selling their wide tourniquet. I don't like their narrow one. I don't think it'll get the occlusion, but the wide ones that I've tested, no, I've never used it on a real life patient. My cat tourniquets, yes, absolutely. I've used it several times on real people, real arterial bleeds. They work. I know they work. There's 27 years of data of it being used in GWAT overseas, but the snake staff tourniquets look to be the real deal. I've tested them. I've tested them with a Doppler. I've gotten full occlusion on them, arm and leg. So I'm bringing out some more equipment. I've got more kits available. I'm actually getting ready. Within the next week, I'm testing a couple pieces of equipment, but I'm going to have an emergency dental kit, an ear, nose, and throat kit. And the dental kit is not just like, oh, we've got a little bit of this. It's a full dental toolkit along with some emergency, like if you have a cavity come out, but even if you have a tooth come out or whatever, what you could pack it into. all that stuff with some instructions. And that in my advanced class, I go over that. I go over it in the 2-day class, a little bit of dental emergencies, but in the advanced class, we actually start doing some dental treatment and things like that. So you've got to think about things. People don't think about dental emergencies or eye, ears, nose, throat stuff. They think about the trauma stuff, but you got to think about, what do you do if somebody is dehydrated? What do you have on hand to do that? Do you know how to start an IV? Do you have the IV fluids? And yes, Max, before you say it, I have your IV fluid stuff. I just got to send it to you and put it up for you to purchase.
Skeins finally showed up after
There
30
she is.
minutes.
But
you said something about the dental thing. Think about, I mean, I know you need, for cuts and all that kind of stuff, but think about when you have a toothache. There is nothing more miserable to me than to have that pain in your mouth. It seems like when that's going on, it just consumes you. I don't know. Sometimes I think I'd be better off having my hand cut off than having mouth pain. I can't stand it. It just, you can't even function when that's happening. You've got to have, you got to take care of that stuff too.
Prepared Citizen there. And I know I actually have one of his devices. He makes some cool stuff, and he sells medical kits and does some classes and stuff. The book he's talking about reading, Where There Is No Doctor, those of you who have taken my class will recognize that book, because that's one of the books I show you that it should be a must-have in your library of medical references. And I actually, when I worked overseas, I had that book with me, and the book of Where There Is No Dentist. But just like the dental stuff you were talking about, I'm actually playing with some herbal remedies too, and some actual homemade toothpaste that actually helps with reducing cavities and actually curing cavities, infected teeth. It's a toothpaste that you make yourself, but it's some herbal stuff. And, there's going to be clove oil in it and things like that. So there's a lot of stuff that I'm doing also on the herbal side that I'm starting to play with that can do that. I mean, there's comments, people who are going to now. I'm just one of those people. I'm not going to talk about herbal stuff until I'm comfortable to do so, because I actually know that I've used it. I've made the stuff, because I'm not going to be one of those hypocrites.
And we are working on an herbal class after the festival. We got somebody lined out, and we got to finalize all the details, but we will be having an herbal class probably a month after the festival. So just keep that in the back of your minds. And Terry, Shelly, you took care of, you got the dates and everything for that. Terry was asking about that.
Yeah. One of the things that I want to point out, so you can go to KentuckySustainableLiving.com to get information about Chuck's class. It's going to be on Friday, March 22nd. It's the day before the festival. And I'm telling you, he will not stop. Like, when it gets to the end of the day, if you still have questions, if you still have things that you want to know, he will go until you get everything that you need out of that class. Like, seriously. And, he's got, kind of an agenda lined out about what he's going to teach. But if you have questions about other things, he's going to teach you about those things too. So keep that in mind. But even if you don't come to Chuck's class on Friday, at the festival, Chuck is going to be doing a demonstration about building a medical bag. And he's going to have tons of supplies there at his booth. And so you may go and watch his demonstration. And if you bring an empty backpack with you or whatever, and you can purchase stuff from him and build that medical bag. And not only that, he's going to ask you what you're doing. He's going to ask you, is this something you want for your homestead? Is this something that you want, you want to keep in your car, like a bug out bag or whatever it is? And, or even if you're even if you travel all the time or you're a truck driver, he can specify or specialize that bag that he's going to help you create to whatever it is that you need. So, he's very, very hands-on with that and just caters to whatever his customers need. And I really like that about Chuck.
Yeah. And Chase is going to be there too.
Yep.
He's going to get upset if we don't say that.
Yeah. Chase always helps me. He helped me this past weekend, but he
sucking money off of you.
Yeah. Well, he ended up jumping into class to become a student.
Don't be mean to Chase. We like Chase.
But no, he's very helpful to me. He's very knowledgeable. I mean, he's he has the knowledge because he was immersed in it since he was a kid. I felt it was important that he knew this stuff. I mean, he was putting tourniquets on before tourniquets were cool. You know, when he was 7, my 7-year-old grandson can do it.
And Chase Nick's an excellent victim.
Yes, he does.
Yes.
So, but yeah, we're going to build you a kid. And the thing is I want to know, as Shelly said, do you have kids in your house? What type of medical problems do you have? Whatever, because I want you to be able to have a custom built, tailor-made kit around for what you're going to experience and what you need. Evan Dix from Radio Made Easy, we were at a class last year in Ohio, and he literally brought me an empty special operations equipment medical backpack and handed it to me, and he said, fill it up and bring it to me later on at one of the other places we'll be at. And I did, but I asked him a lot of questions. Do you want stuff for your kids? Do you want, and I made one section of it, one of the large tear-off med pack, that was all kid stuff, custom made, and I even put Band-Aids in it that had like dinosaurs on them and other stuff. He has girls, so, you know, I had to make it girly. Whatever it was I put on there, but just little things like that. I know it sounds funny. Well, Band-Aid's a Band-Aid. Oh, when a kid has to have a Band-Aid, they think it's the end of the world. You can calm that child down by having them just look at dinosaurs on a Band-Aid or having little things like that that's custom built, because they're not small adults. They're children. It's completely different. So I try to do those things. And that's also important knowledge I try to pass on in the classes to do that, because I want to know those things. And you're right, Shelly. I've yet to teach a class where we stopped on time. Self-Reliance Festival, I did a half-day class, a wound care class, and I think we went, I think Dean's in here, he could tell you, I think we went an hour and a half or over than what it was. Your class, you know, the class we had there, what did we do? We went to like 6 o'clock, 7, I mean, it was like 10-hour day.
We started at like 8 and went to like 6 or 7.
I'm not one of those people. You're paying me for a service, and you're there to learn something, so we're going to go until you learn it. I mean, and I want you to make sure that when you walk away, you felt like you got a good deal. Your money was well spent, and, you know, you're walking away with actionable information.
Yeah. And that the cool thing about having Chuck build you a medical bag or a truck bag or whatever is it's not going to be some of this crap that you look off Amazon and you order. You look 700-piece first aid kit, and 500 pieces of it are crappy Band-Aids in different sizes. It's going to be stuff, you know, if you do a 500-piece kit, there's going to be 500 pieces of real stuff, not just fluff in there.
Well, right. And it's real equipment that's going to fit you. And just like the classes, you know, Jason will tell you, before I came down, I was like, well, what do you want to learn? This is what I can do. What is good for you? What's your past training? Because I may be coming to a group where they've had some previous other medical classes. I don't want to sit there and repeat stuff that they know and they're comfortable with, and they don't need to relearn. We can review it, but I want to tailor it to you. Is there certain things you want to focus on and stuff like that? So all my classes are tailored to that. And I kind of do that with the students when they get in there. I start asking, what do you really want to do? What do you want to learn? How do you want to do stuff? And we do it, and we'll concentrate on that, because you're paying me for a service. It's not, I'm there to serve you, you know, and I want to make sure you walk away with the best experience as possible. Mm-hmm. Tim's in here. I see him. He was at this past weekend. Chase was there, and they could tell you, I mean, we trained until we were done. We went over the days, and we had fun. That was a little bit different type of a class, but it was fun, and we trained hard.
Yeah. And it's not just sitting in there. Nobody's going to fall asleep in this class. Anything like Chuck said, death by PowerPoint, and Chuck touched on it earlier. I brought a TV down from the house, and I was pissed off because it took longer to set the TV up than to look at the stupid 3 slides. I'm like, damn, dude. I was like, we spent an hour doing this to look at 5 minutes of slides. I'm like, in that hour, everybody could have walked up to the laptop and looked at it for 10 minutes and then moved off.
It was funny because almost the same thing when I did a class at Bob Lester's last year. He did the same thing. He brought a TV in and hung it up in the building we were having class in. And it was funny because that's what it was. He did it because I told him, I said, yeah, if you can have something, if it's easy. So he had a TV hung on the wall, all this. I plugged in, did a short video, a few slides, and he looked at me and he went, is that it? I said, yeah, and it was the same thing. It took me an hour to set this damn thing up, and you use it for 5 minutes. You're not there to stare at a screen. You're not there to have something read to you. You're there to learn skills, and adults are tactile learners that you learn by doing, and that's what I want you to do. I don't want to waste time jibber jabbering. Let's get to it and put our hands on it and do the real stuff.
Yeah.
Well, and the thing about the doing it, it's going to help you remember it.
Yeah.
I mean, you can sit in front of somebody and be lectured and all of that kind of stuff. But if you put your hands on it and you practice it a few times in Chuck's class, you're more likely to remember it. And I'm just honestly, the best part of that class is the piece of, when something happens, it's stressful. Like you might watch a million YouTube videos of how to do something or whatever, but when the rubber hits the road and something traumatic happens or an accident happens, it's scary and you will panic. And even if the only thing that I can think is that you have like people like Chuck who have been on ambulances and trauma nurses and medics in the Army, they probably don't panic because they deal every day with that. Somebody like me, even Randy walking in there with that tube coming out, I still panicked. But that response time for me was quicker than it normally would have been because I'm like, okay, I've got this. I know that I can do this because, you just take a deep breath and get over it. That's the best part of this training because he teaches you how to do stuff and I don't know. It just put me in a different frame of mind because I knew that I could handle what was going on because I'd had the training. You know what I'm saying?
That's kind of the motto of my company. It's train with confidence. You're going to be confidently trained. And that's what I want you to do. It's reps, it's having the information, and it's also understanding why you're doing it. You have a lot of classes that go, do it this way. And I had somebody this past weekend tell me, oh, I've always done this. I've had this class, but I did it because that's what they told me to do. I had no idea why I was doing it, but I try to explain the pathophysiology of what's going to happen and the expected result you should have, what to look for. Right. Is it working? Is it not working? And, like in your class, Shelley, that you all took, how many uses did you find out with a stethoscope or how to do a blood pressure without a stethoscope? Without a blood pressure cuff, you can guesstimate what somebody's blood pressure is, or if they're in shock. I mean, it's little things and little tricks, and it's not rocket science. Everybody thinks medicine's rocket science, and yes, all the nurses, all the doctors, everybody start your hating. It usually happens, but it's not. It's skill and knowledge, and I'm just passing on that skill and knowledge to you. Yes, you have to go to a lot of school, and there's a lot of training, but I'm kind of cutting out some of the fluff and just getting you to the bare basic and the bones of it that you need to know and what you need to know and look for. And again, you're walking out of a 2-day class and you're about this far away from being an EMT in 2 days. That takes 147 hours of instruction. I'm just cutting out a lot of the BS bookwork.
So I can tell people I'm almost a paramedic now.
You can tell them you're almost a doctor if you want. Nobody's going to believe you anyway, but go ahead.
I'm going to order a lab coat when we get off here.
You need one. You need Dr. Jason. You need to wear it during the festival.
Underneath it should say almost professional.
Yeah, Chase said that I didn't have a pulse.
Yeah.
I had a hard time. We had a hard time doing that for me. So.
Well, and you will, and you've got to learn other places. People think, oh, I can't find a pulse. I can't find it. And they start panicking. I went, look at them. They're talking to you. They obviously have a pulse. All right. It's common sense. Just like in the patient assessment, I'm teaching those things because that's the things you need to know. A lot of this is common sense. You already know it. Somebody just hasn't presented it to you in that way so you can figure out, because a lot of it is like, oh yeah, that's easy. That's easy. That does make sense. That is pretty common sense. It's like you said, Shelley, it's just taking a deep breath, common sense, and doing it.
Yeah. Yep. So we are 44 minutes into the video. Do we want to give the details about the festival, Jason?
I guess we can if we have to. So I want to get a shirt that says I'm not a doctor, but I'll take a look.
Max will come up with something. Everybody needs to go to Max's path, to his website, and he's got, I wish if I had it with me, I'd show it to you. He's got t-shirts and a hoodie with his famous saying. I'll let him put it in there, what it is and how to get it. But you really need to go in there and and get one. I bought a t-shirt and a sweatshirt. Actually, he made the hoodies because I wanted one. And I actually wore it a couple weeks ago to a class, everything, and they were like, people were looking at me, and I wore it out, and they were kind of looking at my shirt, and I got questions about it, so it was kind of fun to ask about it. Carrie, she's here too. Good people right there also.
Yeah.
Awesome. Yay. So our festival is going to be March 23rd and 24th at the WKU Ag Expo Center in Bowling Green, Kentucky. You can get information about the festival at KentuckySustainableLiving.com. Chuck's class, the Homestead Medical class, is going to be on the Friday beforehand, but Chuck will also be doing a demonstration at the festival how to build a medical bag, so you can come and take notes, and you can even bring a bag and Chuck will help you fill it up with all his supplies at his booth. And then we also have a ham radio class that is happening while Chuck's class is going on Friday. That's going to be taught by S&B Radio. So go check that out. Both of those classes are on the website. There is a $35 fee to get into the festival. That's the Friday and Saturday part. But hold up, I'm going to give you a promo code to get $10 off your ticket. Hold on just a second. Jason, if you want to tell more while I get that code.
Yes, the ticket, the admission is for all weekend. And like I said in the very beginning of the video, if you didn't catch that part, go back and listen to it. A lot of people have been confused. Chuck's class and the ham radio workshop are just extra add-ons to the festival. The $35 admission is for Saturday and Sunday. You get all your access to all the vendors that are going to be there. I think we've got close to 70 vendors that are going to be there right now. It gets you access to those, all the demonstrations that are going on, and all the speakers that will be there. So that's what the $35 covers. We've got some awesome raffle stuff also. Dakota Lithium Batteries has sent me product. We've got a solar generator that we're going to raffle off. We've got planter. It's Metal Planter Boxes Direct, I think is the website. They sent us metal planter boxes for raised gardens. We've got some of those we're going to raffle off. And I know there's a bunch of other stuff that we got on there. And Shelly just posted the coupon code.
So that coupon code is email25, and that will get you $10 off your ticket. So you can get your ticket for $25 with email25. What else? We're gonna have Backwoods Butcher there, and he's gonna be demonstrating how to process a lamb.
Kyle,
so if you all
haven't seen Kyle Backwoods Butcher, he is a great person. He's fun. He's got a big TikTok page that he does lives on. I'm actually looking forward to that. That's one of the things I'm really excited about is to see Kyle and him do his thing.
Yeah. Shelly, go over all their speakers that we've got. I know you got the list. I'll forget somebody.
So William Bond is going to be there. That is, for those of you who know Permapasture Farm, William is Billy and Michelle's son. He's going to be there talking about permaculture and homesteading, like how to start your homestead the permaculture way. He's also going to bring his microscope and stuff. And if you want to bring soil to get your soil tested, or that's not what I'm looking for, for him to analyze your soil, I guess, because he's gone through Elaine Ingham's soil class, and he can tell you how healthy your soil is. So if you want to bring a sample of your soil, he can do that for you. We're also going to be having Jeff Smith. He's going to be talking about Preparedness 101. Jeff was at our festival last year. Y'all, he is a wealth of information. And he always has a vendor booth set up, and he has all kinds of cool stuff that you can buy, like prepper stuff, old tools, all of that kind of stuff. You want to check him out. We're going to have Jason, the Angry Prepper. Now, Jason at KSL is going to tell you a little bit about him because I don't know a lot about him.
Jason, Angry Prepper, he's a New York fireman, lives in New York. He's going to be talking about urban bug out and getting out of an urban area, but he's coming down from New York. He's a wealth of knowledge. It'll be a great time to come down and meet him. Who else have you got?
We're
you
gonna
got
have
Chris-
Toolman. We're gonna have Toolman Tim. He's gonna be talking about getting rid of the poverty mindset. Y'all, that just needs to stop. We've got so many people in the world that are so dependent on government and relying on everybody else to take care of them. Just stop that mess.
It's
And
okay. The government's going to help. It's just fine. You all just sit back and just wait on them to come get you.
I'm going to go cross the border and come back and get some free shit.
Yeah. I want
okay, y'all. Okay.
$3,000.
We've got Rachel who's going to come talk about raising dairy sheep. She's going to be there. We've got, do y'all know who Chris Weatherman is? Do you know who Angry American is? Have you read the Coming Home series or the Going Home series? That's what it is. So he's written like 23, like post-apocalyptic books or prepper books or whatever you want to call them. And I'm just going to be honest with you. I had not read any of his books. And Jason's telling me, we've got Angry American. He's coming. And I'm like, I feel like I need to read a book so I know what's going on, or I can talk intelligently to this guy. I am now
sucked in.
I am completely sucked in. I am completely invested in Morgan Carter and his whole thing that he's got going on. My favorite character is Thad. I'm on book 4. I just can't deal. Like, I love it. His books are awesome. I cannot wait to meet him now. And he's going to have a booth set up. I'm sure he'll have his books for sale, and you can get them autographed and all that kind of stuff. But I'm super excited about meeting him.
And you're on book 4 in what, like a month?
It's like 3 weeks.
Yeah.
I'm completely sucked into this.
I wanted to
Chase, yes, Emily will be back with her milk cow. She's bringing a whole stinking petting zoo with her.
Yeah, she's going to have a petting zoo this time.
And we will have McMurray Hatchery sending us chicks. So we'll have chicks there where the kids can look at chicks from McMurray Hatchery. Shelly, tell them about the other animal that'll be there.
Oh my gosh, I'm so excited. Okay, so have y'all seen those Scottish Highland cows?
The teddy bear cows.
Like the hairy cows with the shaggy haircuts, and they're kind of red or whatever. We have a vendor that's coming in, and they have Scottish Highland calves that they're going to bring. And they have a whole photo booth set up that they do, and you're able to get your kids' picture taken with these cute Highland cows. These are the cows that everybody wants, that, like you have them on your farm and you're like, I'm never going to eat that cow. I can't have one of those cows because I have to have animals that I can eat. But nobody wants to eat like the cute Scottish Highland cows. But
I'm hearing the money ring right now from my daughter-in-law going, oh, we got to get pictures for the grandkids. We got to.
That's right. I'm super excited about this. I don't personally want one because, like I said, I couldn't eat it, but I'm so excited to see them. I just think they're so cute.
I wanted to mention Carrie's on here, and she'll post up what her website is, but she's bringing her stuff. She's vending for the first time, and she's got a lot of really good products. She's got a good stuff. She's a good person. I've met her, and you all may have met her at Self-Reliance Festival, but she's coming, and I'm glad that she's going to be a vendor, and she's going to get to show her stuff. And then I know some people were asking about other classes and stuff. I am going to be doing other classes at other places, but, get out there and train no matter what. If you don't take it from me and you can't stand me and you hate my guts, whatever, I don't care. Still contact me. I'll tell you who to go train with. I'll tell you some of the people. Prepared Citizens on here does classes. TAC Response. I'm actually going to be teaching a 2-day class at Tactical Response this summer, July, right after their alumni weekend. And then there's been talk, there's possibility of rumors of some new classes and curriculum being developed for tactical response that maybe I'll be involved with. But that's stuff that you all could do and train. And there are also local businesses who are part of this network that you can go support. Get on Jason's channel and Shelly's channel, Two Old Crows, and make sure you subscribe to them. They give valuable, actionable information. I learn stuff from them all the time. When they're getting up, Jason does a lot of videos, so does Shelly. And I'm telling you, you'll learn things from watching these people and all the people in the network. there's several people in the comments right now. Max's Path, Kiri, all these people have their YouTube channels that they're doing stuff, and you can learn from them. We should all be supporting each other, every single bit of it.
Yep. A couple other people that we're going to have. Bill Stormfeather is going to be there. Now, he was supposed to be at the last festival, and then he had something come up with his job, and he had to be at that. So he had to miss that one, but he's planning on being there, and he's going to be talking about the first 30 days. So what that means is like the first 30 days after an economic collapse. He has been in other third world countries where this has happened, witnessed it firsthand, and he's going to be sharing with us what you can expect if something like that happens.
I'll just say this. Bill's job is not a job that, he had to stay behind and do some paperwork. Bill does real shit, and his job required him to be going and doing real shit. So if any of y'all have a clue, you'll understand that. So I would highly suggest that's just one reason alone to come out. And then Chris Weatherman and Angry Prepper. I mean, all of them, the lineup and the people that are going to be there, Tim, everybody, William, there's so much to learn from across such a broad spectrum. You're crazy for $35. And I've seen some of the people on the web complaining about a $35. It should be free. That's an absolute poverty mindset. If you can't come up with $35 to get thousands and thousands of dollars of education in 2 days, you're crazy. I mean, you're not serious about wanting to do this. That's what it comes to. You're all talk. Come out, train, and invest in your time and your future of learning this stuff.
Yeah. And then the last one that I have on here is Amanda Blount, and she's going to be teaching about micro farming. She's going to be teaching you that it doesn't matter how big your property is, you can farm and make money off of that farm and do the whole homesteading thing. You want to come check these people out. They're going to help you be successful in the whole homesteading, preparedness, place, whatever your interest is, they're going to help you do it.
Well, and it's also what hasn't been mentioned, and maybe it has a little bit, but I think it needs to be touched on more, is the networking. It's the other people you're going to meet who are coming to this, who are like-minded. And you may meet somebody that you didn't know lives 15 minutes from you. And, that could be a resource to you. You all can have a group, and it's building that community, and even the larger community and network that comes out of that. And the three sisters, of the Self-Reliance Festival and the Midwest Preparedness Project, all of that comes in, but all of it's crossed, and the whole community's crossed, but it's that networking. I mean, Shelly and Jason are friends. Jason and I talk almost every day, because we met through these networks and starting this. And I'm actually on the committee this year for the festival, and I wanted to see it succeed because it was very successful for the first time on the last one, and I can't believe how big it's grown. I think Vaughn, Cardelie's on here. Her and Jose, who I met with who are good friends, and she come to. You meet all these people from all over the country. You never know when you're going to be traveling. I can travel just about across country in almost every state, and there's somebody in the network that I know lives in that state, because you never know when something happens, you get stranded, and you're going to need some help, and it's going to be some of these people who are going to be there for you.
Chase, EMP Shield will most likely be there. If they don't come, we will have an EMP Shield to give away. So
I'll talk to Patrick and make him come there. I'll guilt him.
Yeah. Well, I've talked to him. He just said right now, right this second, it's up in the air, but he said that they are committed to.
Well, I'll just go to the chief. I'm just going to go to the head. I'll get a tag.
Yeah. And we'll touch on this, and we'll kind of talk in code because they'll kill the video. But VC or V4CR, Shelly, can you put a link? That Saturday night we are going to have a charity dinner for this organization, and it deals with the scum of the earth and she'll put a link in there. Go check their website out. And we're getting nailed with comments. Hold on. But yeah, we're having a charity dinner Saturday night for them. There's tickets where you can buy those on the website. with that charity dinner, you're going to get to sit down, have some one-on-one time with all our speakers and presenters and everything, and promote a super good cause. And I'll post there is that.
If you go to their YouTube page, so you just look up that, it's the same name. You just look up that on the YouTube page. And the reason we're not saying it is because for some reason, the powers that be doesn't like this. And that tells you a lot right there. But if you go to their YouTube page, there is a video on their YouTube that it's about an hour to an hour and a half long, something like that. It's a documentary. It's called Contra Land. And you can, it's a whole movie about what that organization is about. So if you're not sure whether or not it's something that you want to support, go watch that movie and then you'll understand what you're supporting. Like Jason said, you'll be able to come to the dinner and you'll be able to sit down with the speakers and talk to them one-on-one, pick their brains about whatever you want to find out about as far as your homestead or preparedness or whatever. But ultimately, you are supporting this organization and helping us to raise money for them.
And it is a very worthwhile thing. It's great. The very first charity dinner we did for them, we raised almost $11,000 for them. We're working on some great auction items for that, so you can get some really cool stuff. Last time we had a custom fire pit that we auctioned off. Squatch survival gear is probably going to be there and give us another bag. They make some awesome bags. We sold one of those. I know we've got a custom knife that we're going to auction off. Shelly, what else? There was something else.
I'm building a custom home medical kit to be auctioned off that will either probably be in an SOE bag of some sort. It's going to be in one of their backpacks. So it's going to be a big medical pack, not some little like IFAC. It's going to be like a true home medical kit.
That's awesome, Chuck.
So see, there's another auction item. Guys, this charity dinner is near and dear to our hearts. They're the charity that we've chosen and we're going to stick with. And we're going to do this every time we have a festival. There's going to be a charity dinner associated with it. And right now we're working with them to get the stuff going from the last charity dinner where they can do some actionable stuff in Kentucky for us. So.
Yeah, the charity dinner was great. It's a great cause, but again, if you all can make it to the festival, there are so many big and so many big names in the whole YouTube world and the prepping and homesteading world and all that. But I mean, when you put all these people under one roof, I mean, Tim Cook, Toolman Tim's coming from Canada. All right. He's coming from Canada to be here. And you got Chris Weatherman and, just all of them, all the people that are going to be there, from the big names, even to the small names as speakers. You could learn so much from these. Yep. From everybody that's going to be there. You're crazy not to come. You're crazy not to support this. It's 2 days, 3 days if you're going to take my class, because you're going to take my class, aren't you? That's money well invested. So
yes,
3 days of your time that you can walk away with so much actionable information that you could set yourself up for success for many years to come.
Oh, yeah, for sure. And it's, if you don't care anything about seeing the vendors, if you don't care anything, and you're crazy if you don't like some of the stuff that's going to be vended there, if you're not crazy about, I just don't want to go see some YouTube star or some crap like that, come and sit down. There were people all day long sitting at the tables just talking to one another. I mean, and they didn't see a bunch of the speakers. They just sit there and talked and networked with everybody, which is some of the best part about it.
Yeah,
so
absolutely.
But there's going to be vendors, everybody from medical supplies to homemade soaps and salves to tinctures to custom knives. Hell, you can buy a John Deere tractor or a John Deere skid loader at our festival if you want.
You're going to have freeze-dried food.
Yeah, freeze-dried food.
Aren't they? Is Grumpy cooking breakfast?
Yeah. Grumpy's going to be cooking breakfast both mornings. So You'll have breakfast. We're atoning for our sins on the last one. We have a coffee trailer.
Oh,
We'll
yeah,
be there
that was bad.
all day. They're going to have regular coffee and have all the frou-frou crap too with it.
Well,
so
I don't care about just as long as there's regular coffee. The other thing is I can attest, like the guy who does the knives, the knife maker, he makes excellent stuff. I mean, there was so many good vendors, and I know a lot of them are coming back. What's the one guy? I always forget his name. That has the hats.
Jeremy with Hot Brass.
Yeah, Jeremy from Hot Brass. He makes some really cool hats, and I'm not going to say what he does for a living because I'm not sure how. I just don't want to get him into trouble. But you need to go talk to Jeremy when you find his booth. He's not hard to miss. You'll know.
Hopefully Jeremy will be there. There's another event, and he's trying to decide which one he can make it to.
Yeah, I hope he's there because he's just a real interesting guy himself. Grumpy Acres, of course, is part of the network. Good people. Just all the vendors that are going to be there. Who else is going to be there? Oh, Bruce. I forgot Bruce with his other stuff. Just a lot of really cool stuff that bring some money to spend because you're going to be buying things and you're going to have a chance to buy stuff that's not going to be anywhere else.
There's going to be tons of good stuff there. The vendor lineup this year is probably 3 times what it was last year. And literally, like I said.
And I don't think you've mentioned it, but doesn't matter what the weather is outside, all of this is indoors. It's in a big indoor arena. All of the vendors, all of it. So you don't need to worry about whether it's snowing a blizzard outside or it's a Sahara desert or whatever. You're in a environmentally controlled, arena, and it's a very, very nice facility.
Yeah, and I mean, like Chuck said, it's all a climate controlled, enclosed area, and you don't have to worry about it. So, all right. Does anybody else got anything?
Yeah, make sure.
Can't wait to try Carrie's sauces and her caramel. I can't wait to try that.
Everything she makes, I can't eat, but I'm going to do it anyway.
Oh, yeah. I'm going to hit that. Chuck, there might be banana pudding for you.
Yeah, well, it'd be nice if there was some left. I mean, I was just teaching a freaking class, and that's the only thing I wanted to eat, and I get there, and you hogs ate it all.
Mike... Chuck was licking the bowl of banana pudding. I looked over and I was like, what the hell?
That's the only thing that was left. I had scraps I had to get from everybody else.
I'll have my wife make your very own.
Terry,
keto options.
Terry, there's not tent camping at the event or at WKU. You can only do trailer camping there. But Jason, what's the name of that? Oh, there's a KOA campground that is like 5 minutes from the festival. Yeah. And I know they have tent camping there. So you may want to check that out.
Yeah, there were several people who brought their campers. Well, you did, Shelly, didn't you?
Yeah, I did. Mm-hmm.
So, all right, guys, I guess we're going to close it out. And I'm going to go eat dinner. And I appreciate everybody being on tonight, all the comments and everything. Chuck, take it around the horn. Tell everybody.
Chuck Peebles with Homestead Medical. My website's homesteadmedical.us. I sell custom medical kits, equipment, components. Come spend all your money that you have with me. I also do medical classes. I do custom medical classes. I come to you. Chuck at homesteadmedical.us. I'll come to you. Reasonable distance. All I need is 6 students. If you're on the wrong coast out west, like California, I'm not coming. I'm not coming to Illinois, and I'm not coming to Maryland. Those are not friendly carrying states, and so I'm not coming. Anywhere else, I'll come to you. If you're farther out west, maybe need some more students, but yeah, I'll do custom classes for you. I'd love to train with you.
Shelly?
You can find us at 20 Crows Homestead on YouTube. You can also find us at 20crowshomestead.com where you can buy soap. What else? That's
amazing soap.
Amazing soap.
Yeah. I'll close it out. I'm Jason with Kentucky Sustainable Living. You can find me on YouTube. that's about it. I hope to see everybody at the festival. Come out. It's going to be an awesome weekend. And I appreciate everybody being on here. And we will be back next Thursday with another guest for a Thursday Festival Live. And
don't forget that $10 off code, email 25 to get $10 off of your tickets.
Yes. And purchase your tickets ahead of a time. That helps us out a whole bunch on planning and knowing what we can do for this festival. You can still buy tickets at the door, but it's a lot better if you buy them ahead of time. So we will not give coupon codes at the door either.
Yeah, they'll be $35 at the door.
Yeah. So, all right, guys, y'all have a good night, and we will see y'all next Thursday.
Thank you all.
Bye.